Hello everyone, and thanks for joining us for the video today. This is a really large subject we're going to try to tackle, and in fact a friend had asked me to cover this before and it was so overwhelming I have procrastinated. I apologize to that friend. So today's topic is autism, and there is absolutely no way I can cover all of the details on one short video and still keep your attention. So I hope you find this helpful, and if so, please give me a like, and I would appreciate it a lot if you subscribe if you're not already. So autism is a huge subject, and I just want to really share my heart about a few specific areas of it. First of all, it's confusing because throughout the years we've used different terminologies within the pediatric behavior and developmental communities. I can remember in residency we often called it pervasive developmental disorder, or PDD. We also often sort of dance around the diagnosis and call it sensory integration disorder. And so that can be confusing in and of itself, and autism is very much on a spectrum. So you'll hear us say autism spectrum disorder, meaning that that child's disability could be anywhere from extremely mild, they may be exceptionally high functioning, straight A student, scholarship student, just slightly socially awkward towards more of an Asperger's syndrome area, all the way to completely nonverbal, non-communicative at all, and just extremely low functioning. So be aware that there's a tremendous amount of difference between levels of diagnosis. Okay, a lot of parents worry because they see their child do an activity or a behavior that they have seen a child with autism do, and they're afraid that means their child has autism, and that is often not at all the case. So please don't panic. Now, on the other hand, if your pediatrician tells you that your child needs to be evaluated for autism, believe them. There's a reason they're saying that. We know to look for certain things, such as a lack of eye contact, a lack of hugging, but again, I know children who have been diagnosed who are fine with those things, a lack of fine motor developmental control, a lack of expressive language skills, several things we monitor for, and we're very specific about screening for autism, and your pediatrician should be as well. At the 18-month and the 2-year well check, we will administer a developmental assessment called the MCHAT, the Modified Checklist for Autism in Toddlers, which is a validated screening tool. Now, it's not completely diagnostic, it's just a screening tool, but it's enough that if there are abnormalities, marked abnormalities on that we would recommend your child get a complete developmental evaluation. Now, remember, that is in their best interest. The best outcome is when a child is diagnosed early on and can access early intervention. Now, as far as intervention goes, that's typically with autism. This is a neat story. Through the years, occupational therapy, which is known for working with patients for fine motor skills, has sort of taken over this world of autism. They do such a phenomenal job. Children with autism may have several things that make them stand out: the expressive language delay, the fine motor delay, a very unusual way of playing, a very unusual way of interacting with their world. They can be easily overwhelmed by sensory input, and yet they may seek additional sensory input. So there's a lot of ironies there are in their lives. They may refuse to eat vegetables because of the texture, and yet they'll put things in their mouth that aren't food items as well. So it can be very confusing. So some things that children with autism do, like repeated stereotypies or stereotypic behaviors that they repeat over and over, repetitive behaviors, a child without autism could also do that, such as head banging. Some babies will bang their heads on the crib because they don't want to go to sleep and they're trying to keep themselves awake. So even though children with head banging could have autism, just because they have it, it doesn't mean that they do. So I want you to remember that as well. So remember, this could go by different titles. Remember, this could present in different ways, and that a complete evaluation is essential for diagnosis and therefore early intervention for better outcomes. Remember that the diagnosis alone doesn't give you all the details you need of that specific child, and that therapies are extremely effective. Also interesting is that ADHD can be on the same giant spectrum as autism. And we know with ADHD that overuse of screen time early on can increase your odds of having that diagnosis at a later age. So certainly it would be the right idea to limit screen time in all children under 2, just in case it had any possible correlation with additional diagnoses later. With autism, typically we see it much more frequently in males than females, and it does tend to run in families. I would love to give you this fantastic news today that it has absolutely been disproved proven repeatedly that there is any sort of causation between vaccinations and autism. So you can completely lay that to rest in your heart. Vaccines are not the cause of autism. So I want to encourage you to get a full evaluation done if you have concerns or if your pediatrician has concerns. Definitely voice these concerns to your pediatrician so that we can do the proper evals that we're able to do in the office, or refer you out to a specialist, or a behavior and developmental specialist is who we often use for this, or a neurologist. So please talk with your pediatrician if you have concerns, and if they do, follow through with that referral so we can get that child started in early intervention and have much better outcomes. I just had one more final thought, and that is, please remember to show extra grace. If you see a child in a grocery store or in Walmart or somewhere like that, or at church, who is simply falling apart and cannot pull it together, remember that child may not be spoiled as you're thinking in your mind. There are plenty of children out there who do lack limits and lack consistency and structure from their parents and consequences, but sometimes that child could have autism, and because they process all sensory input differently, things can become overwhelming to them in a way that they can't bring themselves out of. Their parent is already completely stressed dealing with this and dealing with this in public, so the last thing they need is a shameful or a mean look towards them. Please show extra grace, kindness, and even support to them if you are able to. Children with autism often have a difficult time transitioning or just acclimating themselves to new environments, things that we could tune out, they're not able to tune out. So please show extra grace for the child, and especially for that parent who may be in an embarrassing public situation. Thanks.